Welcome to this introduction for EverMed Direct Primary Care and our new partnership with CCPN and CCPN member clinics across North Carolina. My name is Seth Shostrom. I'm the Chief Strategy Officer for EverMed and also a long time ago alum of the University of North Carolina at Wilmington. So I'm very excited to get back into my alma mater state and reconnect with all my friends in the Carolinas. So we want to do this quick introduction just to give you a concept of why CCPN contracted with EverMed and why it can be a very positive fit for your practice. First off, what is direct primary care? In a nutshell, it's just a fixed low monthly fee for all your foundational primary care services. So EverMed contracts with employer groups to embed solid primary care as a foundation to their employee health plans. We contract with local independent clinics, and that's where you guys come in. EverMed has a concept, we like separation of church and state. So EverMed doesn't, nor will we ever own our own practices. What we like to do is take the patient and match them up with the provider and then get the heck out of the way. So we find that works very well, and that's where you get the best physician-patient relationship, and that's where you drive the best care. There's no copays to collect, there's no billing to chase down, and there is some level of telemedicine access that we can get into in a little bit that makes it a very efficient methodology to provide care to the patients. EverMed Direct Primary Care, we really like the idea of returning the focus of healthcare to the patient. I think we find over the last 10, 15, 20 years, we've kind of gotten away from that and more into checking boxes for insurance companies. This gets all that swept off the desk and gets us purely focused on the patient once again. Now, direct primary care is not insurance, but it is just an affordable option to access genuinely quality care at a local primary level. And we find it works very well. Now, why would an employer group want to engage in this direct primary care model? A fascinating thing happens when you reconnect the patient and physician and you rebuild that relationship to where it really should have been all along, is you start to drive at fairly major downstream cost savings. So when the healthcare consumer starts to look back to their primary care physician, basically as their champion for care, you start to see unnecessary urgent care and emergency room visits start to decline as they get much better advice, much better triage from their primary care practice. And it turns into pretty impressive savings for a large employer group. A self-funded plan, on average, saves anywhere from 20 to 30% of their total healthcare spend when they inject direct primary care into their health plan package. That's why in some cases, an employer will actually pay a little bit more for their primary care in order to achieve that downstream savings of fewer ER visits, fewer hospitalization admissions. Why EverMed Direct Primary Care in particular? So EverMed really tries to manage the entire direct primary care experience so that the clinicians really can not have to worry about, well, what's a direct primary care patient versus an insurance billable event. All that kind of goes away. See your patients, put your notes in your EMR, and the system will automatically account for what's billable and what's not billable. It actually makes a very easy relationship. But we do a lot of marketing to build your practice. So we have major broker and employer relationships really throughout the country and very heavy in the Southeast. So it's a very good patient pool. We call it a healthy patient stream because we only work with employer groups. So you have folks that are genuinely employed and generally healthy. They're not necessarily health seekers, although they're of course folks who want to know that healthcare is there when they and their families need it. There's a lot of ACA compliant pairing options that brokers will embed EverMed Direct Primary Care into. So you guys don't have to worry about, well, gosh, I've got their primary care needs met, but what the heck do I do when I have to refer them out? Well, they always have a complementary health plan attached to it. So EverMed DPC is just a part of their overall healthcare package. So when you refer out, or if you even do things within clinic that are beyond the scope of direct primary care, they can still be billable, and there's always an employer health plan that will pick up that side of the billing very cleanly. We offer things like vaccine discount programs and also have a prescription discount program and a mail order service for patients as well. as we try to round out their healthcare experience. Really want care conscious, cost conscious healthcare decision making. So a little bit more about EverMed Direct Primary Care and why employers do this. So again, EverMed provides a new healthy stream of patients to the practices, and you get a consistent, reliable practice revenue month over month. So you always know exactly what you're going to get from the EverMed DPC patient pool. It drastically reduces administrative burden because you're not collecting copays and you're not chasing down billing. You automatically receive payment for the census members to your practice each month. On average, a fee-for-service patient, national averages, is worth about $450 a year to a practice. The average direct primary care patient under the EverMed model is worth about $720 a year. When we did a comparison with RVU units, the average direct primary care patient in EverMed practices actually earned about 28% higher RVU than the closest commercial plan. So it's very revenue positive for the practice. A lot of our clinicians, probably our biggest compliment that we get with a practice that has been with us for a year is they're like, you know what, Seth, I actually enjoy practicing medicine again, because they really do get to let go all the nonsense that the industry is driven into caring for patients, and just allows you to do that, focus on the patient, and enhance that relationship between the patient and your practice overall. Who are EverMed DPC clients? Our most common client is a large employer group that has a self-funded healthcare benefit. When you embed direct primary care into a genuine self-funded plan, it just connects really well. It's a very healthy experience both for the employee, the employer, as well as revenue positive for the practice. So it's a really great fit. As the healthcare industry has evolved a little bit, we start to see things like DPC plus MEX, a CDHP plus HRA or HSA plan with direct primary care embedded is really starting to become more common. And then probably really the most common that we've seen over the course of the last year are level funded health plans. So that's a baby step into a self-funded plan. It's really a self-funded plan with caps on it for the employer group. And direct primary care works really well in that environment. Basically, the better the plan performs, the more of a discount that the employer receives. So they really drive good healthcare decision-making practices in their populations, which I think you guys will enjoy as well. We have several school districts and municipalities that come on board. A lot of them are self-funded trust type plans. And same thing with trade associations. And then we've started to pick up some really large national retailers, which will have a specific effect on the North Carolina market. So we're very excited about some of those coming along as well. What's covered under direct primary care? In a nutshell, it's all the things you would typically think of as basic foundational primary care. It's your, cold and allergy, sniffs and sneezes. It's your annual wellness exams. It's your school sports physicals, and things like that. It's pretty common sense, basic foundational primary care. We'll be able to provide you with a specific list right down to the CPT code of what's covered or included in the DPC menu, and you'll find it matches up to the fee schedule really well. This thing is designed to be a win-win-win across the board. It's a win for the employer because they save in their overall healthcare spend. It's a win for the employees and their families because they save in out of pocket and they get access, fantastic access to quality primary care. And again, it's a revenue positive, low administrative burden for the practices. So it's a win-win-win all the way around. Here's a quick glance at the lives we have matched up to the CCPN marketplace. You'll see the coverage is pretty spot on of having lives where the practices are. So we're excited to bring all this together and start these lives rolling. We'll get a big bump in this fall season and then get more throughout the course of the year. We talked a little bit about clinic revenue, and we can get this type of information in your hands as well. It shows the PMPM. There's a rider in the state of North Carolina for members under the age of 2. And like I say, it's very revenue positive, clinic friendly model of providing healthcare. We'll provide this calculator you can plug in. Well, I think I can take this many patients and allow you to run with it. So we allow each clinic to set their own capacity for patients. If you're unsure or you're down a provider, you can set that capacity to 0. So you have the opportunity to receive employees, but you don't have to take them. If you don't have the capacity, you can dial it to 0. Or even if you're wary, you're like, gosh, I don't know, I got to see this thing work a little bit. You can dial it down to 0. You don't have to take the patients, but when you're ready, you can crank that thing up to, hey, Seth, give me as many patients as you can, to, you know what, I think we can handle about 200 patients right now. We can cap your practice at the appropriate level so that is a comfortable fit for you. Again, we looked at revenue tables, and it's roughly about 20% higher than most commercial contracts that we've seen. This case is an actual clinic that we pulled the data from, and it matched up exactly as we had predicted. Next steps, there's an acknowledgement form for CCPN member practices. That acknowledgement form allows you to dial in your capacity from 0 to a set amount to give me as many as you got. I like more revenue, and we have the capacity to take on new patients. So you get to set that. You can send us a logo, so we can put your clinic logo. There's a little clinic profile that goes out so that when we build the employee selection tool, you get to share what's special about your practice, and that actually encourages and entices more of those employees and families to select your particular practice. Other than that, we're always accessible. We're very excited to work with CCPN and all of their member clinics. We look forward to talking to you very soon. Take care.